The triple-demic is now in full swing, with COVID, flu, and RSV now overwhelming hospitals from New York to California. Brian Yennis is at Cohen Children's Medical Center in Queens.
Our emergency rooms are busier than ever.
The flu season has hit the U.S. early this year and with more intensity, and hospitals are struggling to keep up. Hospitalizations due to seasonal influenza are now at a 10-year high, with the CDC reporting just under 9 million cases, 78,000 hospitalizations, and 4,500 deaths so far this year. Some lawmakers now calling on the Department of Health and Human Services to do more to help relieve hospitals that are being pushed to the breaking point.
We're short of doctors, we're short of nurses, we're short of respirators, we're short of beds, that they can come and supply those things immediately.
And it's not just flu. There's also a major uptick in COVID and RSV cases nationwide. COVID is hitting the West Coast particularly hard. In Los Angeles County, the weekly average of new cases is more than 3,000, a 44% increase from last week. And some say more infections are likely in the coming days.
When you look at the wastewater epidemiology, the amount of COVID that we have around is actually quite high.
Ultimately, most doctors say there are ways to stop the spread and avoid a so-called triple-demic if folks can return to pandemic-era safety practices.
Good hygiene, good hand washing, the use of masks, which we know that have worked very effectively.
Here at Cohen Children's Medical Center in Queens, New York, we're seeing about a 50% increase in pediatric admissions a day. Typically, they're used to seeing about 200 children a day. That number has risen up to 300. In Queens, New York, Brian Yennis, Fox News.